Now we will start to solve some questions related to local anesthesia. But before that, you have to remember three important things that are very important for solving any kind of question. First is maximum recommended dose. How much dose can be given to a patient? The amount of lignocaine, how much lignocaine can be given, maximum amount of lignocaine, or how much maximum amount of adrenaline can be given to a patient. This is MRD. So, when lignocaine is given with adrenaline, the maximum dose is 7 milligram per kilogram, or maximum dose can be less than 500 milligram when it is given with adrenaline. Why? Because we can give high amount of lignocaine. If it is given without adrenaline, if it is given without adrenaline, then maximum recommended dose will be 300 milligram, because vasoconstriction is not there and lignocaine will flow into the blood vessel. So, for with adrenaline patient, maximum dose is 500 milligram. Without adrenaline, maximum recommended dose is 300 milligram. How much adrenaline can be given to a patient? So, in healthy patient, it is 0.2 milligram of adrenaline can be given to a healthy patient. And in cardiovascularly compromised patient, the amount is 0.04 milligram. These are the figures, these are the numbers you have to remember. The 500 milligram for with adrenaline, 300 milligram without adrenaline, 2 milligram for healthy individual adrenaline, and 0.2 milligram for healthy individual and 0.04 milligram for CVS patient. These are the numbers you have to remember. Second, we need to understand. So, this was the first thing you need to remember. Second thing you have to learn is what is 2%, 4% and 8% of lignocaine means, and what does 1 raised to 80,000 or 1 raised to 1 lakh amount of 1 lakh adrenaline means. So, 2%, 4% or 8% of lignocaine simply means 2% is 2 grams in 100 ml of solution. 2% means 2 gram in 100 ml. Similarly, 4% means 4 gram in 100 ml. And similarly, 8% is 8 gram in 100 ml. For adrenaline, 1 raised to 80,000 means 1 gram of adrenaline in 80,000 ml of water. 1 gram in 80,000 ml. So, if it is 1 raised to 1 lakh means 1 gram of adrenaline in 1 lakh ml of solution. This is second thing you have to learn. Third thing is how many ml is present in one cartridge, one dental cartridge. You have seen this metallic cartridge, right? Metallic syringe. In those metallic syringe, we use this cartridge. This cartridge contains approximately 1.8 ml, or for the simplicity, we can use 2 ml of lignocaine. So, solution in the one cartridge is 2 ml. These three things you have to remember. Now, let's do some questions. First is, how many cartridges of 2% lignocaine without adrenaline can be given to a healthy patient? So, we have 2% lignocaine. Second is, it is without adrenaline, right? So, what will be the maximum recommended dose? MRD will be 300 milligram. So, how many cartridges we can give? So, for that, let's divide this. First step, 2% means 2 gram in 100 ml. So, 2 gram in 100 ml means 2000 milligram in 100 ml. That means 20 milligram in 1 ml. This was first step, 20 milligram in 1 ml. Second step is, it is without adrenaline. So maximum recommended dose is 300 milligram. So if 20 milligram is there in 1 ml, how many ml will be required for 300 milligram? So 20 milligram in 1 ml. So this will be 300 upon 20, that is 15 ml of solution will be required for without adrenaline. Third is, how much ml is there in one cartridge? 2 ml. So how many cartridge for 15 ml? 7.5 cartridges. Simply 15 by 2, 7. So 7.5 cartridges, that is 7.5 cartridges will be required or can be safely given to a healthy individual with 2% lignocaine without adrenaline. Suppose the numerical says with adrenaline, then again we have 2% lignocaine. Maximum recommended dose MRD with lignocaine with adrenaline is 500 milligram. 2% means 2 gram in 100 ml, that is 20 milligram in 1 ml. Our cartridge contain 2 ml, so 1 cartridge will contain 40 milligram, because 1 cartridge, that is 2 ml. We can give 500 milligram. So how many 2 ml cartridges can be given? Directly 500 upon 40, that is 12.5 cartridges. So with adrenaline we can give 12.5 cartridges. Without adrenaline it was 7.5. This is simple numerical. This is the simple steps for the numerical.